Otter Tail Telecom for hosting our program. I'm Shannon Terry, the Public Information Officer for Otter Tail County. We hope that this show is an opportunity for Otter Tail County to share information about our programs and services. Today, we will visit with Jessica Metzger. She's a public health nurse with Otter Tail County. Welcome, Jessica, and thank you for being here.
Yes, you're very welcome. Thanks for having me on today.
Yes, it's really good to have you here. So Jessica, as a public health nurse for Otter Tail County, what role do you play in protecting the health of Otter Tail County residents?
So my program area is disease prevention and control. So we love acronyms. So it's called DP&C. So I work a lot with anything that's disease related. One of my main program areas is immunizations or vaccinations. Kind of those are used interchangeable a little bit.
Okay, so that would be a really good place for us to start. Why vaccinate?
Well, it's really important to vaccinate, and the reason for that is when you vaccinate on time, and I think about children mostly, because it really starts at infancy for individuals, or actually even pregnancy. When moms are getting pregnant, it's so important to follow a schedule. And if it really prevents the children and people to not be exposed to vaccine preventable diseases, which really are just a plane trip away, if you really think about it. Yeah.
Do you have an example of one of those diseases?
Absolutely. Oh, there's lots of diseases.
Okay.
So I think about polio. Really, we don't see polio around here in the United States. It's very rare. I mean, doctors don't see it. New doctors coming out of med school, they're not seeing polio. But if you go over to any of these third world countries, they see polio, and they are dealing with it every day. I think about even tetanus or diphtheria. There is measles. Measles is really making the news, and there's even more cases of measles out there. And if people aren't vaccinating for these diseases, they are coming over here from different countries. And measles doesn't even have to be third world country. It can be any country. And we are just seeing a rise of vaccine preventable diseases surfacing again here in the United States.
And there's a schedule, right, of at certain ages
Yes.
you should have these vaccines. Could you give us a little bit more information about where
Yeah.
would people go if they want to know what vaccines they should have for themselves, for their children?
Absolutely.
And really, where can they even get these vaccines in Otter Tail County?
Sure. So it really, like I said, it starts at pregnancy. And when you are pregnant, there's a vaccine that is recommended. It's called the Tdap, which is the tetanus, diphtheria, pertussis vaccine. And that is given to pregnant moms, I think usually in their last trimester. And that is to help protect the baby from pertussis. There is some cross protection that happens. So it really starts with that. Then you've got your childhood series we talk about, up to date by age 2. That's your primary series for these infants to age 2. And then you've got your other group, which is kind of your preschool kindergarten group, and they need shots for school, a lot of booster doses. And then you've got your teenagers that are needing meningococcal, the human papillomavirus, a booster of tetanus, and then of course adults. And all of these vaccines are important throughout your whole lifespan. So when people think that vaccines are just for kids, they're not. It is an entire lifespan. There are many, all clinics in Otter Tail County carry vaccinations. So anyone can get vaccinated at their regular clinic. If there is no insurance for children and some adults, we do have vaccine programs through Otter Tail County that we can help vaccinate. It's called the Minnesota Vaccine for Children. And we also have the and underinsured adult vaccine program. So many acronyms. There should never be a barrier to anyone getting vaccinated, especially here in Otter Tail County. All of our clinics here are Minnesota Vaccine for Children providers. So any child of the age 0 through 18 years of age can get free vaccine if they qualify, meaning if they don't have any type of insurance. As far as schedule and learning more about where to find, what's recommended for your child, you can go to many different websites. There's the CDC, which is the Center for Disease Control. There's the Minnesota Department of Health website. The Children's Hospital Philadelphia is a wonderful website, a resource for many different things. And there are people that like to look at different sites that are not governmental sites. And I can appreciate that. And the Children's Hospital of Philadelphia is one of my go-to sites for many things. And of course, our Ottertail County website has been updated recently, and we have just all those links that I just talked about are all on our website.
Oh, great.
So if you go to the public health department, I think immunizations should be an option for you to look at. And so those will take you to any links. We've got some videos on there, and we've really updated our website. And I'm always available too, for questions or any kind of questions people might have.
Thank you.
Yeah, absolutely.
We really have heard about vaccine hesitancy.
Yes.
Could you explain what that means and maybe what has influenced vaccine hesitancy over time?
Absolutely. So, unfortunately, in recent years, we've experienced in the United States just a rise in this vaccine hesitancy, which is a delay in the acceptance of vaccines. So they're maybe not accepting it right at birth, but maybe they'll accept it later in the child's life, or they just refuse vaccines altogether. So children are being unvaccinated, and they're very, very just at risk for disease, of course. So the influence we've seen is really the lack of trust to the medical community. Concerns about the vaccine safety, how the efficacy, so how well does it really work? Is it really necessary? The convenience, and there are other issues, of course, related to it. But really, those are kind of the main things we see around the vaccine hesitancy. Is just, and unfortunately, there's a lot of sites out there that are not credible. And what I tell people is to get fully informed, you really need to make sure you're looking at something that is credible and approved. Anyone can make anything look credible on the internet. And so you really need to make sure you're looking at a trusted website.
That's really good advice.
It is. And if people don't know if it's trusted or not, public health, we can certainly try to help you with that. If you're saying, I'm looking at this website and this is what it says, if I don't know the answer, I have people that I can contact and they can help me with how credible a site really is.
So after hearing about vaccine hesitancy, what happens when a parent decides not to vaccinate?
Well, a parent's decision to not vaccinate his or her child not only puts that particular child at risk for infection, but also every child that comes in contact with that particular child. I should say every person that comes in contact with that child. Lower rates of vaccination increases the risk of preventable diseases and outbreaks in our community. We've seen that in the Twin Cities with the measles outbreak. We've had pockets of communities that don't vaccinate for certain vaccines or any vaccines. And people talk about herd immunity, and I don't know if you've ever heard that term or not, but herd immunity, I don't really know if it exists anymore. And we have such a large pocket of people that aren't vaccinating, and the people who don't vaccinate tend to hang out with other people that don't vaccinate. And so it's just, a lot of the disease can spread. And with all the international travel and airplanes, and just people are so mobile, even from just county to county or state to state, we do see that disease is very easily spread. And if you aren't vaccinating your child, you are really putting a lot of others at risk. Some that I think about are the children who parents would like to vaccinate, but they're going through chemotherapy, or they're going through some kind of a treatment where they can't be vaccinated. So that child still goes to school and still does all of its normal activities the best they can, but is at more risk if people are not vaccinated within the school that they go to or within the community that they live. So it's kind of a scary thing. I have 3 children. All 3 of my children are fully vaccinated. And I do let parents know that when I talk to them about vaccine hesitancy. I want them to know that I would never do anything for their child that I wouldn't do for my own. And I'm very pro-vaccine, and I make sure that my children are very well protected.
And the consequences of getting a disease like measles, it's life-threatening, isn't it?
Absolutely, absolutely. And a lot of adults that have had measles, they're like, oh, well, I lived through it. That's true, but people, this day and age, we don't see we're not seeing those diseases, so maybe they aren't caught as quickly. But there are complications, even with chickenpox. There are complications, and the older you get, when you get the chickenpox, for example, the higher you are at risk for complications. And so people just really need to look at the benefits versus, just weighing those options, for sure.
Well, thank you. Could you maybe explain a few other initiatives that Otter Tail County Public Health Department is working on?
Sure. As far as my program area goes,
Will there be some flu clinics coming
Yes,
up?
absolutely. So I start ramping up for flu in August, and I feel like it's a never-ending process for me. But yeah, we'll be looking at flu coming up here. October is kind of our hit the ground and running month. We will be in some communities, so be looking for press releases. We'll have things on the radio, and our website will have all of our schedules. We'll be doing the schools, so parents should be looking for papers coming home from their school districts. And we always can take appointments as well. If there's community members that need to get in for flu shots, we certainly can do those as well.
Okay, it sounds like Public Health Department of Otter Tail County is a very valuable resource.
We are, for many different things.
Yes. And again, we've just highlighted one of the programs of Otter Tail County's Public Health Department. There are many more areas that public health is working and providing services for the residents of Otter Tail County.
Absolutely, absolutely. And if you ever have questions about those, our website's great, or just calling our main phone number and just asking.
And we'll have contact information provided during the show. So thank you, Jessica, very much for being here.
You're very welcome.
Thank you, Otter Tail Telecom, and thank you, viewers. Otter Tail County, live your best life here.